Welcome back to Oakland Basketball Halftime here on the Real Team Real Estate Radio Network. Right now, as promised, we're joined by Dr. Ramsey Shehab with the Henry Ford Health Systems. And Dr. Shehab, I've been looking forward to having this conversation with you for a couple of reasons. And number one is I've been trying to shed a lot of light onto this for the common sports fan. With everything that's going on right now, Dr. Shehab, these teams aren't just showing up and going on the court and playing basketball. There's meticulous planning. There's everything that's involved with it. I know you're working intimately with NBA teams as well. So, I mean, take us through. You're kind of I know you don't want to be referred to as this, I'm sure, but you're kind of the COVID go-to guy right now, Dr. Shehab.
Yeah, I've become more of a COVID officer than a sports medicine doc over the last 6 to 7 months. And it's been a challenge, not just for me, but for the coaches, athletic trainers, and the players involved. It takes everybody being on the same page to get a basketball team on the court. Everybody has to buy in, and the buy-in is tough because it's brand new, and it's tough to sell a brand new product to young kids. And we're dealing with college kids who sometimes it's tough to adapt, but they've done a tremendous job. The regulations and the rules that we've had to follow have been pretty challenging at times, but everybody's come through, and we were able to play when we were supposed to, and that's just because of everybody's hard work. We kind of follow CDC guidelines. We follow kind of consensus statements from the American Medical Society for Sports Medicine. And as you know, I'm one of the team docs for the Pistons, and a lot of the stuff I do with Oakland is based on the same principles we do with the pro teams. So that's kind of unique to Oakland, and I think that's helped us get to the point where we are.
Joined by Dr. Ramsey Shehab here from Henry Ford Health Systems, and as he said, he's kind of a COVID officer now, more than a sports medicine doc, but we certainly do appreciate his time on the Real Team Real Estate Radio Network. So, Dr. Shehab, you mentioned it, getting buy-in, right? And I think across the board, whether you're in the medical profession or wherever, that's, I would guess this, I'm saying this, you can let me know, buy-in probably is one of the toughest things that you have to deal with. And I say this again because I know intimately when we're on the road, and I'm a guy, if I go to Chicago, I like to go take in the city and everything like that, but that's off the board right now. When we go to these cities, I know what I'm doing. I'm going in the hotel and I'm there until we go to the arena, and that's it. I'm buying in, as you say, and the rest of the team is as well. And has that been the biggest challenge, I guess, for you guys, especially working, professional athletes, college athletes who, let's be real. There's kind of a sense of maybe invincibility to them. They need that edge to compete. Has that been the toughest challenge for you so far?
Believe it or not, no. The toughest challenge has been COVID itself, because when we first started, we didn't know much about it. It was brand new, and the more we learned, the more we've had to adapt our policies, our testing, and our train of thought. So the science and the virus and the medicine has been the most challenging aspect. The players, for the most part, they get it. They realize what's at stake. We've had, multiple talks, educational sessions, starting way back in the summer, and they get it, and they've lived through it. They've experienced it. There was a shutdown that we had to do in order to make sure this thing didn't spread before season start, and everybody bought in. And I got to give credit to our coaches at Oakland, because they've allowed me, and they've allowed Chris Kern, our athletic trainer, and his team to really make this work. And so no, the players have been fantastic. It's been the virus that's been the most challenging, but Oakland's been up to it.
Shed some light on that for everybody, where we are with COVID-19 today versus where we were, say, on March 30th, where I know how I was living. Going to the grocery store for the family during shutdown was no fun task at all, just the pressure that was going on around it. Just break that down in kind of mathematical terms for everybody, how far you guys have come in terms of how you treat it, how you deal with it, how you prevent it, all of it.
Yeah, we've come a long way. When when we first started to learn about COVID, we thought it was kind of a close cousin to the flu, and everybody thought it was a pulmonary virus. And the more we found out, it's actually more of a vascular disease than a pulmonary disease. It attacks the blood vessels, and through the blood vessels, it can get to the heart, the brain, and essentially, and the lungs. And in high risk, say patients, but high risk adults, it can be deadly. So, we've come from thinking this was just a pulmonary virus like the flu to more of it could be a serious issue. In athletes specifically, in some occasions, it can cause a myocarditis, which is an inflammatory condition in the heart, and that can lead to an arrhythmia and sudden death. So we have to be very careful if somebody's tested for COVID or somebody's had a close contact with COVID. We need to make sure that we do the right return to play protocol, which includes thorough cardiac testing. We usually get an EKG. We usually get a troponin, which is a heart muscle enzyme. And in some cases, we even get echoes or cardiac MRIs. So, when this hit back in March, and Christian Wood was one of my first players that I had to deal with COVID, we really didn't know that. And it's come a long way, but we have a better understanding for it now. And we have rigid protocols to ensure player safety. At the end of the day, it's not about playing basketball or playing soccer or playing football. It's about our kids' long-term health.
Make sure you tune in next broadcast on our halftime show. We'll be joined by Dr. Ramsey Shehab again, and we'll continue this discussion and all that and more. I'll get you caught up with scores from around the Horizon League. You're listening to Oakland Basketball on the Real Team Real Estate Radio Network.